and we'd operate together. So finally he said, now Dorothy, he says, I can teach you in 5 easy lessons how to take that little muscle out of the middle of the pelvis. So you're wasting your time. He said, you need to be in general surgery. I said, fine, put me in there. So Chief put me into general surgery.
Now, this was at Meharry?
At Meharry. And before I got through with that 5 years, some of the fellows used to call me Mule Brown because I worked so hard. And I never let anything bother me. I was going to make that 5 years, and I made it as the first woman trained in general surgery at Hubbard Hospital.
I wanted to talk about that now. Looking back at Meharry, when you first went to Meharry, of course, I think you've already indicated that they tried to steer you into nursing and other areas. But what was it like being a female and the lone female in such a situation? And that would be a difficult situation even today. But during that time, when certainly there were very, very few women who were as courageous as you were during the time, what was it like in that situation?
It was tough, T-U-F-F. It was really tough. I mean, the fellows used to give me the business. And I would work the patients up, and then they would take the patients that I worked up and take them to the operating room and operate on them. And I would be lucky if I could be standing down at the foot of the table. But I was just insistent that I was going to do that. And I think, you know, with all credit to Dr. Walker, he saw how set I was, and he helped me in every way. I recall one incident when the chief resident was on me like white on rice. That's the only thing I can say. And he announced, he said, okay, Dee, says, we're going to start grand rounds on your ward tonight.
They call you D.
Yeah. And so I missed supper. I was over there making sure that I had everything in apple pie order. Well, here comes the chief at 6 o'clock with the retinue behind him, you know, his right in order, you know, his assistants and all the way down to the medical students. We got into the first ward, and I gave the record of the first patient, and we called him Scooty. Scooty jumped on me. He says, you didn't do this, you didn't do the other. And so I just decided that I had had enough. So I said, well, just a minute. So I walked out to the nurse's station, got my little short white coat, put it on, and went on down on the elevator down to the snake pit. The women lived in the snake pit. We called it the snake pit. It was a room behind emergency because they wouldn't allow us to live up in the doctor's quarters with the men. You know, I don't know what they expected we were going to do anyway, but at any rate, I went down there and they were playing Dirty Hearts. I said, deal me in. They said, aren't you supposed to be on ward rounds? I said, say, deal me in, because I'm not going to ward rounds anymore tonight. Telephone rang outside, and it was Scooty. He said, Dee, he says, we're waiting for you. Are you coming back? And I said, no, I'm not coming back, because I am sick and tired of all your foolishness. I went back in, sat down again. The telephone rang again. And it was Dr. Walker. He said, Dorothy, he says, I want you to come up to my office. Well, I knew that that was going to be my last day of training in surgery, because you didn't get away with the talk like that, see? And so I walked into his office. He says, I understand you're having trouble with my chief resident. I said, no, I'm not having any trouble. He said, well, did you curse at him? And I said, yes, sir, I cursed at him. And Scooty jumped up and said, and Chief, she cursed at me the second time. He said, did you curse at him the second time? I said, yes, sir. Well, he leaned back in his chair and he looked over at Scooty and he said, well, I'll tell you something. Because I never complained to the chief. I took everything that they laid on me. He says, I'll tell you something. If Dorothy didn't get excited and vent her mind, I would think she was crazy, because he knew what I was going through. He looked back at me and he said, now, I'll tell you what I want you to do, Dorothy. He says, I want you to go back down to the snake pit and go to bed and rest your nerves and get up tomorrow morning and come back up on the ward and try not to curse at the chief resident too many times. But it was really an experience. And I think that everything that I went through, I looked down the road and saw other women coming behind me, and it wouldn't be just quite as tough. for them.
It was a challenge. You recognized it as a challenge and something that you had to...
Yes, because I've had girls tell me, in fact, we have a girl over at Brentwood who said that she told her mother told me that when she was very, very small, she said, I'm going to be a doctor like Dr. DBrown. And see, that's what it's worth.
Good.
And I think it's a valuable thing.
Now, and of course, you have many other careers, and one of the most important, I believe, is that you've been involved in politics. I think we've had members of the Tennessee General Assembly on this show on several occasions, female members of the General Assembly, Mary Pruitt, Henry Brooks, and Thelma Harper, and I think all of them have indicated that they owe a deep debt of gratitude for the political path breaking that you were involved in. Now, how did you make that transition from surgery really into politics, and when did that happen?
I really didn't make a full transition. What actually happened was, in the latter part of the 60s, the decade of the 60s, the Supreme Court had handed down an edict of one man, one vote, which meant that they had to alter the districts, the voting districts. And in so doing, there was one large inner city district, and most of our folks lived in that inner city district at that time. And it meant that, and as the fellows told me, they said, now we want you to run for the legislature because you're well known and you're informed, and we want you to do this. Well, I said that I'm busy. I'm practicing medicine, and I don't know enough about politics, you see.
So you were a reluctant warrior.